Welcome back, everyone. Today's lecture is going to be a slightly longer than usual. We are covering Chapter 10, which includes the cardiovascular system, the immune system, the lymphatic system, and blood. I know that sounds like a lot to pack into one chapter, and it is, except that there are a lot of terms that work through each of these systems, which is why they're all grouped together here. Cardiovascular system is made up of the heart, which is going to pump blood throughout the body, and the blood vessels, which include arteries that bring blood away from the heart, veins that bring blood back toward the heart, and capillaries, which are the smallest vessels where gas exchange takes place. And we're going to look at a picture of this in a couple of slides. There are multiple functions of the cardiovascular system, so we'll touch on a few of them here. First off, the heart has two separate sides, the right side and the left side. The right side of the heart receives blood from the body and then pumps it to the lungs. The left side of the heart receives blood from the lungs and then pumps it out to the body. Some functions of this system are regulating temperature throughout the body, carrying oxygen, carbon dioxide, and nutrients, as well as circulating hormones for the endocrine system. And there are many, many other things that circulate in our blood. Here we've got a picture of the heart, and as medical terminology students, we're not expecting you, or I'm not expecting you, to memorize the exact anatomy of the heart here. If you want to learn more about the heart, you can watch my anatomy video on the heart. But I do want you to learn some of these structures so that you're familiar when you see a term that it is pertaining to the heart. So let's do a quick overview. So here in light blue, we have the superior vena cava and the inferior vena cava. These are the largest veins in the body that are bringing deoxygenated blood from the tissues back into the heart. They both empty into the right atrium, which is up on the the superior portion of the right side of the heart. From the right atrium, blood is going to flow through the tricuspid valve, which is a valve that has three of these leaflets, these sort of white leaflets here, into the right ventricle. From the right ventricle, blood is pumped through the pulmonary valve into the pulmonary artery. I do want to point out that this is the one spot in the body where an artery is carrying deoxygenated blood. Typically, people think of arteries as carrying oxygenated blood, and in most cases that's true. But the true definition of an artery is a vessel that carries blood away from the heart. So in this particular instance, we have deoxygenated blood flowing through the pulmonary arteries into the lungs. Oxygenated blood from the lungs is going to come back through 4 pulmonary veins. This is the region where veins are carrying oxygenated blood in the body, and dump into the left atrium. Blood from the left atrium is going to go through the mitral valve. So this mitral valve has 2 of these cusps instead of 3 on the right side of the heart. So through the mitral valve into the left ventricle. I do also want to point out that the muscle wall, the muscular wall of the left ventricle is considerably thicker than the wall of the right ventricle. This is because the left ventricle has to create much, much more pressure so that it can eject blood and pump it throughout the body. From the left ventricle, blood is going to flow through the aortic valve up into the aorta. And the aorta is the largest artery in the body. It's going to come up ascending the aortic arch, and then the descending aorta, which is going to go down through the thorax into the abdomen. And you can see it's got multiple branches, which are going to bring blood to the rest of the body. This picture is showing you a very basic idea of what blood vessels do in the body. So blood, like we said, is pumped out through the aorta and then comes to get distributed through the body, and eventually the aorta is going to branch into these much smaller arteries and then arterioles, which are the smallest arteries, and then the arterioles are going to branch into these teeny tiny, almost microscopic capillaries. The capillaries have very thin walls, and they're in the tissues, and this is where oxygen is going to diffuse out of the capillary into the tissue, and carbon dioxide is going to diffuse out of the tissues into the capillaries. So you can see the arteries are all in red because they are oxygen-rich blood, And then from the capillaries, the deoxygenated blood is going to drain into venules. The venules are going to all join to form veins, and then we will have the inferior vena cava and the superior vena cava, bringing that deoxygenated blood back to the right atrium. So we just talked about all of these, but the heart contains the right and left atrium, which are on the superior portion of the heart, the right and left ventricle, which are more inferior in the heart, the atrioventricular valves, which are the tricuspid valve and the mitral valve, and the semilunar valves, which are the pulmonary valve and the aortic valve. We also saw the aorta carrying oxygenated blood to the body, and the vena cava, both superior and inferior, bringing deoxygenated blood back to the heart. When we're learning about blood, we find that there are multiple different formed elements in the blood. So the composition of blood is 45% formed elements, meaning cells, and 55% plasma, which is the liquid portion of the blood. That 45% of blood cells is broken down into erythrocytes, which are red blood cells, leukocytes, which are white blood cells, and thrombocytes, which are platelets. And platelets are not a true cell, they are cell fragments, but they're extremely important in the body as they are the number one element that is used in blood clotting. When we think about the lymphatic system, we have lymphatic vessels, which are similar to blood vessels, except that they allow fluid to come into them from the tissues, but then that fluid cannot get back out. So what they do is they help to drain fluid from the tissues back into the general circulation. So when fluid is coming out of the capillaries and oxygen and carbon dioxide exchange is happening, typically more fluid is going to leave the capillaries than re-enter the capillaries, and that additional fluid is picked up by the lymphatic system. Lymph nodes are good for cleansing the blood and creating lymphocytes, which are the white blood cells that are helpful in the immune defense system. The spleen and the thymus are both organs that are associated with the lymphatic system. The lymphatic system is really important in cleansing the blood, in fighting infection, and returning that extra fluid back into the venous system. It's also important in absorbing fats and fat-soluble vitamins from the digestive system and transporting them into the blood so that we can utilize them in the body. The body has multiple ways to fight off infection and protect itself from infection and disease. And we have these, what we call 3 lines of defense. So we have physical and chemical barriers, such as the skin, which is our first line of defense, trying to keep pathogens out of our body. This is called innate immunity because it's something that we're born with. We don't have to develop it over time. We're also born with non-specific resistance, which is a bunch of different cells that are not after a specific pathogen, but that will attack any cell that looks abnormal. Acquired immunity is specific resistance, and that's a little bit different. So this uses the antibodies. We can create antibodies. So when we're exposed to a disease, the body creates an antibody to the specific antigen that is on that pathogen. So it's like there's a red flag on that pathogen, and so the body will create a corresponding little white flag to fight off that pathogen. Probably making no sense here. So the first time you get exposed to a disease, you create antibodies to that disease. Then the second time you get exposed, you can rapidly create massive amounts of antibody and fight that disease off. So you may be symptomatic the first time, like if you get the chicken pox, you will have the chicken pox and it will be rugged. I had the chicken pox, it was rugged. However, the second time you get exposed to the chicken pox, your body is going to make so many antibodies that you will not get sick with that disease, which is pretty awesome. Vaccines also work in that way. So if you are given a vaccine, with an antigen that the body can identify, you can create antibodies without having to initially be ill with that disease. Here we have some combining forms that are directly related to anatomic structures. So cardio is related to the heart. Lymphadeno is related to the lymph nodes. Myo to muscle. Myelo to bone marrow. And phlebo to a vein. You can also use veno in reference to a vein. These combining forms are used with all of the systems in this chapter. Athero is a fatty plaque, like atherosclerosis. Embolo refers to an embolus, which is a foreign object that blocks a vessel, such as a blood clot, an air bubble, or an atherosclerotic plaque. Ischio means a deficiency or a blockage. For example, the word ischemia is a medical term that combines ischio with emia to mean a blood condition of holding back, or where you are cutting off the blood supply, or the blood supply is being cut off by something. And then thrombo means a blood clot, coagulation, or thrombin. So typically a thrombo would be having to do with the blood clot. Some prefixes that we'll see with these systems: brady, meaning slow, versus tachy, meaning fast, and pan means total or all of something. So one of the terms we'll see with pan is pancytopenia, which is decreased blood. It's a decrease in every type of blood cell. Some suffixes are apheresis, which is the removal of, centesis, which is a surgical puncture to aspirate or remove fluid from the body, megaly, which we know is an increase in size. Sclerosis refers to the hardening of tissue or an anatomical feature of the body. But in this instance, it is going to refer to hardening, like atherosclerosis is the hardening of the arteries due to fatty plaquing. Stasis is the stoppage or slowing of the normal flow of bodily fluids, and often it is used in reference to blood. So I've mentioned a few of these terms already. Atherosclerosis is that hardening of the arteries due to fatty plaquing. Bradycardia is a decrease in heart rate. Cardiomyopathy is a disease of the muscle of the heart. Ischemia is the lack of blood flow. And thrombophlebitis is inflammation-itis of phleb veins due to thrombo blood clots. So inflammation of the veins due to blood clots. Here are some surgical terms related to the cardiovascular system. Angioplasty would be a surgical procedure to the blood vessels. Embolectomy would be the removal of an embolus. Endarterectomy happens to be one of my favorite words. I think it's really fun to say. An endarterectomy is a procedure that are used, they're usually named for the artery that is being cleaned out, such as a carotid endarterectomy. So they would be going into the carotid artery and removing plaquing, or typically it's plaquing due to atherosclerosis, but it could be a blood clot. So an endarterectomy is a cleaning out of an artery, removing typically plaquing from the wall of that artery, and it would be named for the specific artery. Pericardiocentesis is the removal of fluid from the pericardial sac, where fluid does not belong, through the use of a needle. And then valvuloplasty is a surgical procedure to correct the valves in the heart when they are not functioning properly. Some diagnostic terms for the cardiovascular system include angiography, which is looking at or taking pictures of the arteries. Aortogram, similar would be a picture of the aorta. An echocardiogram, which is abbreviated ECHO, and the abbreviation is spoken as a word, echo. So an echo is it's like a ultrasound of the heart while also doing an EKG, and that shows sort of dynamically what's happening within the heart. How hard is it pumping? It tells us what percentage of blood is being ejected out of the heart with each contraction. The answer is not 100%. That would not work. So typically it should be 65% in an average normal adult. And then electrocardiogram, which is abbreviated either ECG or EKG, and both of those are acceptable abbreviations for an electrocardiogram. So an electrocardiogram uses pads that are put on the outside of the body, and they are sensors that are recording the electrical activity of the heart. I want to make sure that you don't get this ECG confused with an EEG. An EEG is an electroencephalogram, which is monitoring the impulses within the brain. So an ECG is an electrocardiogram, and an EEG is an electroencephalogram. Some cardiovascular diseases and disorders not built from word parts include an aneurysm, which is a dilation in an artery. Aneurysms can be very dangerous because when an artery dilates, the wall of the artery gets much thinner and has the potential to break and rupture. Cardiac tamponade is an acute compression of the heart by fluid in the pericardial cavity. So pericardial centesis would be the treatment for that. Cor pulmonale is an enlargement of the right ventricle due to pulmonary disease. So when there's a disease of the lung and you're not breathing as well as you can, and you cannot, sometimes like if there's fluid in the lung, it's harder for the right ventricle to pump blood into the lungs. And so it can back up and cause dilation of that right ventricle of the heart. Myocardial infarction is the medical term for a heart attack. And rheumatic heart disease is an inflammatory disease, most often happening in children and young adults after an upper respiratory strep infection. One of the most serious symptoms of rheumatic heart disease is valvulitis, or inflammation of the cardiac valves. While antibiotics have greatly decreased the incidence of this disease in developed nations, it is still a significant threat in developing nations. Some cardiovascular surgical terms not built from word parts include artificial cardiac pacemaker, which is an implantable device that when the heart is not pumping at its regular rate and rhythm, this machine can stimulate the heart to contract. Catheter ablation is a procedure that treats abnormal heart rhythms or arrhythmias by destroying or disrupting the heart's electrical pathways. Coronary artery bypass graft, and with this one, the abbreviation CABG is spoken as a word, cabbage, and you would usually say cabbage times 3, cabbage times 4. So coronary artery bypass graft is when there is plaquing within the coronary arteries, which are the arteries that supply the heart itself to keep the heart muscle healthy. So occlusal, or closing off of a coronary artery, is what causes a heart attack. So this coronary artery bypass graft is putting in a new artery or creating a new sort of way for the blood to move around the heart to bypass the occlusion. Percutaneous transluminal coronary angioplasty is a mouthful, and it is also called balloon angioplasty or percutaneous coronary intervention, PCI, which I see in records a lot. It be used as PCI. It's a minimally invasive procedure that opens blocked coronary arteries to improve blood flow to the heart. So it is through the skin, percutaneous, and again, minimally invasive, whereas the coronary artery bypass graft requires a cut through the sternum and a full open procedure. Cardiovascular diagnostic terms not built from word parts include blood pressure, which is measured through a blood pressure cuff called a sphygmomanometer on the arm. Blood pressure is measured as two numbers, like 120/80, with the top number being the systolic blood pressure, which is the pressure in the cardiovascular system when the heart is fully contracted. And the bottom number is the diastolic number, which is the pressure in the cardiovascular system when the heart is fully relaxed. So it's important that our hearts do not squeeze too hard and that they fully relax in between contractions in order to maintain a long and healthy lifespan. A Doppler ultrasound is an ultrasound where you can see blood vessels. This makes it easier for inserting PICC lines or IV lines in patients whose veins are not readily accessible or easy to see. A lipid profile is a blood test that looks at all of your cholesterol levels and your triglyceride levels. So this is all of the fats that are circulating within your system. The Sestamibi test is a nuclear medicine test that's used to diagnose coronary artery disease and helps to assess revascularization. So how well are the arteries sending blood after a CABG? Last, we have single photon emission computed tomography, and the abbreviation is pronounced as a word, SPECT, a SPECT scan. So a SPECT scan creates a 3D image and can show the function of an organ, which is pretty cool. Cardiovascular system terms that are not built from word parts include signs and symptoms, like a bruit, which maybe isn't how you would pronounce that word just to look at it. So it is pronounced a bruit. When you are assessing a patient, you listen to specific arteries with your stethoscope over the skin, and you should be able to just hear a heartbeat in the arteries, but a bruit is a whooshing sound within that artery. So instead of a lub-dub, lub-dub, you hear sh-dub, sh-dub. It's also what a heart murmur sounds like when you're listening over the heart, which is down here. A heart murmur is when the valves of the heart are not closing completely or appropriately, and so you hear a sh-dub, 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 instead of a crisp lub-dub, lub-dub. Hypertension is the medical term for high blood pressure. So that would be a blood pressure of over 140/90. Although the American Heart Association is now recommending that everybody have a blood pressure of under 130/80, which in my industry, I almost never see. Truck drivers tend toward high blood pressure because they're in the truck all day, they're getting less exercise, they're sitting, and so blood pressures run higher. A couple of treatments for the cardiovascular system. A defibrillator is an external device that has paddles that are placed on the chest. This is if you watch any of the hospital shows like ER, I'm dating myself, but Grey's Anatomy, they put the paddles on the chest, they yell clear, everybody stands back, and then they shock the heart. So that is used when a heart has stopped beating and it's putting an electrical impulse into the heart to trying to stimulate it to start pumping again. Vasodilators are medications that work to open up the blood vessels, to dilate, that means to get larger, so to open up the blood vessels, and they can be very helpful in treating people with high blood pressure. Some disease and disorder terms referring to blood. We're going to look at embolus and thrombus first. So an embolus is a piece of matter, typically a blood clot or a fatty deposit, maybe a plaque that has broken off from the artery, or it could be an air bubble that's called an air embolus that is floating around within the blood, the arterial system. Those are no good because eventually they will lodge in a very small artery and cut off the blood supply to something. A thrombus is the same thing, but it's attached to the interior of a blood vessel. So if you have like blood clots in your legs, those would be thrombus because they are attached to the blood vessel. If they detach from the blood vessel wall and then they move throughout your system, which they'll often go lodge in your lung, a pulmonary embolus, or in your brain, which would be causing a stroke. So once a thrombus detaches, it is then called an embolus. So that's the difference between those two terms. Leukocytopenia is a decrease in white blood cells. Multiple myeloma is a cancer of the blood. Pancytopenia, I mentioned 20 minutes ago, which is a decrease in all of the different blood cells in the blood. Some blood terms that are built from word parts include hemolysis, which is the rupture of red blood cells. Lymphocytosis, which is an increase in the number of lymphocytes. So when you see cytosis, that's increased numbers in blood. When you see penia, that's decreased numbers in blood. Hemostasis is the cessation or the stopping of blood flow. And phlebotomy is the removal of blood from a vein. So if you go to get a blood draw, that is phlebotomy performed by a phlebotomist. Please excuse my art skills. They are not on point. However, I have a point in showing you what a terrible artist I am. So let's look at diseases and disorders not built from word parts associated with the blood. First, we have anemia, which is a lack of red blood cells or a lack of oxygen in the tissues. Hemophilia is a disease where there is an inherited lack of the ability to create a clotting factor. We have many different clotting factors, which are chemicals that are needed in order for blood to clot. There's this whole cascade of events that happens. And so if you are missing one of those factors, you can't clot your blood effectively. And that can be very, very dangerous. Leukemia is another cancer of the blood. And then sickle cell disease is also sickle cell anemia. So here's my beautiful picture. So this is what a nice healthy blood cell looks like. It's round and it's a biconcave disc, meaning it looks like somebody squeezed it from the center. And so it's very thin in the center, thicker around the outside. In sickle cell disease, red blood cells look like this, like a sickle. If you could picture a handle on that, and then you could, cut brush or something. I don't know what they use sickles for. But either way, this is a sickle cell. And so blood cells that are shaped like this, they get stuck together and they don't have the surface area or the hemoglobin to carry enough oxygen to the tissues. So you end up getting very, very tired and not having enough oxygen in your body. Some blood diagnostic and laboratory terms include bone marrow aspiration and bone marrow biopsy. So the bone marrow is contained in the spongy bone, which is the center of the long bones and then other parts of other bones. And bone marrow is very important in producing our blood cells. So a bone marrow aspiration removes a small amount of fluid and cells from the bone marrow, which can then be looked at under a microscope and evaluated for disease. A bone marrow biopsy does the same thing, except it also removes a small part of the bone along with the fluid and cells. Laboratory terms, we have a complete blood count with differential, which is abbreviated CBC with diff. We pronounce diff as a word, so CBC with diff. which looks at the amount of red blood cells, white blood cells, platelets, hemoglobin, and hematocrit, and gives a lot of insight into what's happening in your blood. And last, we have prothrombin time, or INR. INR stands for International Normalized Ratio. So these tests are done to look at how quickly your blood clots. And so when you have somebody who's on, say, warfarin or heparin, a blood thinner, they have to go and have their blood drawn every week in the beginning to make sure that they're not overcorrecting so that they can't bleed out from, a simple shaving cut or something like that. Blood terms that are not built from word parts include a bone marrow transplant, which is a very lengthy procedure where they have to actually kill the immune system of the host patient and then transplant healthy bone marrow into them so that they can start reproducing that and produce healthy cells. A peripheral blood stem cell transplant. So stem cells are cells that can change into any other type of cell. So you can do a peripheral stem cell transplant. Some other terms are anticoagulant, which is a medication that keeps the blood from clotting. So like I said, heparin or warfarin, Eliquis, those are all different anticoagulant medications. And then venipuncture is the act of putting a needle into a vein. So we use venipuncture during phlebotomy. Some lymphatic system terms, built and not built from word parts, include infectious mononucleosis, also more commonly known as mono. This is a contagious viral infection that's caused by the Epstein-Barr virus. It's also called the kissing disease. A lot of college students end up with it. I may have, but I won't talk about it. Lymphangiography is looking at the lymphatic vessels. So sometimes you might have somebody who's got lymphedema, so a collection of lymph in their legs. And so they need to look at the lymphatic vessels to see why the lymph is not draining back out of their legs. Lymphoma is another blood cancer. Splenomegaly is increased size of the spleen. And a thymectomy is a removal of the thymus gland. Here we have some immune system terms not built from word parts. So anaphylaxis is an allergic reaction that causes a rapid drop in blood pressure and can be fatal. An antibody, we talked a little bit about this before, antibodies are created by the body in order to fight off specific antigens which are specific to individual pathogens. Erythrocyte sedimentation rate, or ESR, is a blood test that measures how quickly red blood cells settle to the bottom of the tube of blood. It's a non-specific test, but an elevated ESR can show inflammation in the body. Immunosuppression is the act of decreasing somebody's ability to fight off infection. So that can happen with medications. So a lot of these biologic medications that we see people on these days to fight off autoimmune diseases put the patient into an immunosuppressed state so that their immune system stops fighting their own body. They can be very helpful. Unfortunately, they also decrease patients' abilities to fight off other diseases or infections. Sarcoidosis is an autoimmune disease where the body creates granulomas, and it can affect the skin and the lungs. And last, as always, let's look at some abbreviations. BMT is a bone marrow transplant. CABG is pronounced cabbage, and it is a coronary artery bypass graft. ECHO stands for echocardiogram, which we talked about earlier. ESR is erythrocyte sedimentation rate. And SPECT is that single photon emission computed tomography. I hope that you enjoyed this presentation of the cardiovascular system. I apologize that it is 35 minutes long, but I hope you all survived it, and I'll see you back here next time.